The Art of Aging, Module 6. Section 1, The Aging Process. Skin, hair, and nails. Dry skin, wrinkles, slow wound healing, age spots, thinning hair, gray hair, fragile nails. Skin changes are among the most visible signs of aging. Evidence of increasing age includes wrinkles and sagging skin. Whitening or graying of the hair is another obvious sign of aging. Your skin does many things. It contains nerve receptors that allow you to feel, touch, pain, and pressure. Helps control fluid and electrolyte balance. Helps control your body temperature. And protects you from the environment. Although skin has many layers, it can generally be divided into three main parts. The outer part, or epidermis, contains skin cells, pigment, and proteins. The middle part, or dermis, contains blood vessels, nerves, hair follicles, and oil glands. The dermis provides nutrients to the epidermis. The inner layer, under the dermis, or the subcutaneous layer, contains sweat glands, some hair follicles, blood vessels, and fat. Each layer also contains connective tissue with collagen fibers to give support and elastin fibers to provide flexibility and strength. Skin changes are related to environmental factors, genetic makeup, nutrition, and other factors. The single greatest factor, though, is sun exposure. You can see this by comparing areas of your body that have regular sun exposure with areas that are protected from sunlight. Natural pigments seem to provide some protection against sun-induced skin damage. Blue-eyed, fair-skinned people show more aging skin changes than people with darker, more heavily pigmented skin. Aging changes. With aging, the outer layer, or epidermis, thins, even though the number of cell layers remain unchanged. The number of pigment-containing cells, melanocytes, decreases. The remaining melanocytes increase in size. Aging skin looks thinner, paler, and clear, translucent. Large pigmented spots, including age spots, liver spots, or lentigos, may appear in sun-exposed areas. Changes in the connective tissue reduce the skin's strength and elasticity. This is known as elastosis. It is more noticeable in skin-exposed areas. Solar elastosis. Elastosis produces the leathery, weather-beaten appearance common to farmers, sailors, and others who spend large amounts of time outdoors. The blood vessels of the dermis become more fragile. This leads to bruising, bleeding under the skin, cherry adenomas, and similar conditions. Sebaceous glands produce less oil as you age. Men experience a minimal decrease, most often after the age of 80. Women gradually produce less oil beginning after menopause. This can make it harder to keep the skin moist, resulting in dryness and itchiness. The subcutaneous fat layer thins so it has less insulation and padding. This increases your risk of skin injury and reduces your ability to maintain body temperature. Because you have less natural insulation, you can get hypothermia in cold weather. Some medicines are absorbed by the fat layer. Losing this layer changes the way that these medicines work. The sweat glands produce less sweat. This makes it harder to keep cool. Your risk of overheating developing heat stroke increases. Growths such as skin tags, warts, rough patches, and other blemishes are more common in older people. Common problems. Skin disorders are so common among older people that it is often hard to tell normal changes from those related to a disorder. More than 90% of all older people have some type of skin disorder. Skin disorders can be caused by many conditions, including blood vessel diseases such as arteriosclerosis, diabetes, heart disease, liver disease, nutritional deficiencies. Your hair and nails help protect your body. They also keep the temperature of your body steady. As you age, your hair and nails begin to change. Hair changes and their effects. Hair color change. This is one of the clearest signs of aging. Hair color is due to a pigment called melanin, which hair follicles produce. Follicles are structures in the skin that make and grow hair. With aging, the follicles make less melanin, and this aging causes gray hair. Graying often begins in the 30s. Scalp hair often starts graying at the temples and extends to the top of the scalp. Hair color becomes lighter, eventually turning white. Body and facial hair also turn gray, but most often, this happens later than scalp hair. Hair in the armpit, chest, and pubic area may gray less or not at all. Graying is largely determined by your genes. Gray hair tends to occur earlier in white people and later in Asians. Nutritional supplements, vitamins, and other products will not stop or decrease the rate of graying. Hair thickness change. Hair is made of many protein strands. A single hair has a normal life between 2 and 7 years. That hair then falls out and is replaced with a new hair. How much hair you have on your body and head is also determined by your genes. Nearly everyone has some hair loss with aging. The rate of hair growth also slows. Hair strands become smaller and have less pigment, so the thick, coarse hair of a young adult eventually becomes thin, fine, light-colored hair. Many hair follicles stop producing new hairs. Women can develop a similar type of baldness as they age. This is called female pattern baldness. Hair becomes less dense and the scalp may become visible. As you age, your body and your face also lose hair. Women's remaining facial hair may get coarser, most often on the chin and around the lips. Contact your healthcare provider if you have sudden hair loss. This can be a symptom of a health problem. Nail changes and their effects. Your nails also change with age. They grow more slowly and may become dull and brittle. They may also become yellowed and opaque. Nails, particularly toenails, may become hard and thick. Ingrown toenails may be more common. The tips of fingernails may break. Lengthwise ridges may develop in the fingernails and toenails. Check with your doctor if your nails develop pits, ridges, lines, changes in shape, or other changes. These can be related to iron deficiency, kidney disease, and nutritional deficiencies. More common problems: obesity, reactions to medications, stress, clothing, exposures to industrial and household chemicals, indoor heating, other causes of skin changes, allergies to plants and other substances, climate. Sunlight can cause loss of elasticity, non-cancerous skin growths, pigment changes such as liver spots, thickening of the skin, Sun exposure has also been directly linked to skin cancers, including basal cell cancer, squamous cell carcinoma, and melanoma. Skin and hair steps. Reduce exposure to ultraviolet radiation. Keep skin moist. Drink 8 glasses of water daily. Do not use heavily perfumed soaps. Eat a healthy, alkaline diet. Add omega-3s. Social effects of aging. Loneliness, depression. Social steps. Stay active in your community. Make an effort to be around others. Section 2. Habits and Principles. See your doctor regularly. Checkups. After the age of 40. Your 40s are a great time to assess your current health state, correct past indiscretions, and prepare your body for many more decades of your life. Your doctor can help by checking you for problems that can rob you of your health. Here's a list of basic tests women should ask for. Note that your doctor may recommend additional tests based on your personal health profile. Blood sugar. Decades of eating the wrong food, think soda, hot dogs, fries, you get the picture, plus weight gain, often due to hormonal changes, may have overworked your pancreas. It can't keep up, and that can lead to diabetes. By age 45, everyone should get a fasting blood sugar test, and then have another at least once every 3 years. Your doctor may recommend earlier or more frequent checking depending on your risk. Breast exam and mammogram. You may be checking your breasts at home regularly and having your doctor do an exam annually, but most experts recommend adding a mammogram to the mix somewhere after age 40. The American Cancer Society puts the age at 45. Not all breast cancer experts agree. When to start? Work with your doctor to decide. Blood pressure. Don't be surprised if your blood pressure starts rising now. That's common. Fortunately, you can lower your blood pressure through diet, exercise, and medication. It's worth the effort. Lower blood pressure is a key factor in longevity. Cholesterol profile. Take heart, this simple blood test can save your life. More than 71 million adults in America have high cholesterol levels, a condition that can lead to heart attacks or strokes, diseases that claim a life every 40 seconds. If you have high cholesterol, protect yourself by changing your diet and taking medications such as statins. Stepping on the scales. You blissfully enjoyed chips and hamburgers while ignoring your expanding waistline, but the scale doesn't lie. Pay attention to the results. Being overweight puts you at high risk for a developing number of diseases, including diabetes and heart disease. Pelvic exam and PAP. Yes, you still need these, especially if you're sexually active. A few minutes of mild discomfort pays big dividends in protecting you from cancer and sexually transmitted diseases. Your doctor can tell you how often you need a PAP test. Looking for moles. Those years of getting a healthy tan can lead to something not so healthy, skin cancer. Luckily, most skin cancers are curable, so don't forget to ask your doctor to check your skin if you find any moles or skin changes. Protecting your eyes. Having trouble reading or working at the computer? It's not unusual. Be sure to get your eyes examined regularly every 1 to 2 years until age 60 to check for common problems. Go more often if you have vision problems or risk factors for eye problems. Checking your immunizations. Ask your doctor if you need a tetanus, diphtheria, pertussis, whooping cough, booster shot, or a pneumonia vaccine. Almost all adults should also get the flu shot each fall. But important, become informed of the possible side effects of immunizations before deciding to vaccinate. Checkups after the age of 50. Be sure your doctor performs these tests after you turn 50. He may order more depending on your health history. Colon cancer screening is recommended for everyone at age 50. The colonoscopy is a test that is most frequently recommended, though there are other options. Ask your doctor which screening test is best for you. Stepping on the scales. This is the age where most people start gaining weight. Watch this weight gain carefully and fight back with healthier eating and exercise. Being overweight puts you at risk for developing a number of diseases, and studies show that weight loss can improve your odds. Blood pressure. Untreated high blood pressure is an equal opportunity killer. It kills your heart, your brain, your eyes, and your kidneys. Don't let hypertension sneak up on you. Get it tested. It's simple, it's cheap, and it's quick. Cholesterol profile. Do you have high cholesterol? Find out at least once every 4 to 6 years, or more frequently if you have a risk of heart attack. Controlling your cholesterol can add years to your life. Blood sugar. Untreated diabetes can destroy your health, causing heart disease, kidney failure, blindness. Don't let it. Get a fasting blood sugar test or other screening tests for diabetes or prediabetes at least once every 3 years, and take control of diabetes early. For women only, pelvic exam and pap smear. Combining a pap test with an HPV test can safely extend the interval between cervical cancer screenings from 3 years to 5 years in many women between the ages of 30 to 65. Women over the age of 65 can stop getting screened if they've had at least 3 consecutive negative pap tests or at least 2 negative HPV tests within the previous 10 years, according to these guidelines. But women who have high risk factors for cervical cancer, such as smoking, a history of HPV, or more advanced precancer diagnosis, should continue to be screened. Mammogram. At this age, all women should have started routine mammograms to help detect any early signs of breast cancer. Your doctor can tell you how often you should repeat the test. Early detection of breast cancer can save your breast and your life. Looking for moles. Love your skin. Check your skin for any unusual spots or moles. Be sure to ask your doctor to check your skin once a year as well. Protecting your eyes. Vision-robbing diseases become more common as you age. Be sure to get your eyes examined regularly, at least every 1 to 2 years until age 60, and then every year thereafter. Go more often if you have vision problems or risk factors for eye problems. Checking your immunizations. People over age 50 should get a flu shot every year. And don't forget, even healthy people need a tetanus booster shot every 10 years. And one of those should contain the pertussis vaccine for whooping cough. Be sure to ask your doctor to update any immunizations you might need. Consider hepatitis A and B vaccines if you haven't already had them. And after the age 60, you should be vaccinated against the herpes virus that can cause shingles. Important note: become informed of the possible side effects of immunizations before deciding to vaccinate. Checkups after the age of 60. Do you know what to do to stay healthy? The United States Preventative Services Task Force and other specialty groups have put together the following recommendations to help keep you healthy, happy, and safe. These are simple medical tests that can be done or ordered when you visit your doctor regularly. Your doctor may recommend additional tests based on your personal health profile. Blood pressure. You could be one of millions of Americans who have high blood pressure and don't know it. Get your blood pressure checked by a healthcare provider every year, even if your blood pressure is normal. You may need screening more often if your pressure is higher than normal or if you have other risk factors. Your heart, not to mention your arteries, brain, kidneys, and eyes, will thank you later. Stepping on scales. Welcome to the weight gain triple whammy. Muscle is replaced by fat as we get older. Then that fat goes down to your waist. Also, you don't burn calories as well as before. Your body's metabolism is slowing down. Take heed. Any weight gain, you could be robbing yourself of good health. Colorectal cancer screening. The USPSTF recommends screening in adults beginning at age 50 years and continuing until age 75. You may need to be screened earlier and more frequently if you have risk factors. Talk to your doctor to see what's best for you. The risks and benefits of screening methods vary. Fecal occult blood testing each year. Sigmoidoscopy every 5 years, paired with fecal occult blood testing every 3 years. Colonoscopy every 10 years. Prostate cancer screening. The USPSTF concludes that there is moderate certainty that the benefits of screening for prostate cancer, measuring the man's prostate-specific antigen, PSA level, do not outweigh the harms in men 70 and older. The USPSTF recommends talking with your doctor about the pros and cons of screening if you are ages 55 to 69. A breast exam and mammogram. Know this: breast cancer risk increases with age. Therefore, it's especially important for you to get that mammogram. A mammogram is recommended every 1 to 2 years starting at age 40 or 50. Not all breast cancer experts agree. Talk to your doctor about when you should begin regular mammograms and how often you should get them. Protecting your eyes. Eye diseases such as macular degeneration, cataracts, and glaucoma are common with age. Screening can preserve and maximize your vision. Ask your eye doctor how often you need to have your eyes checked. Hearing test. At least 25% of people aged 65 to 74 have disabling hearing loss, most of which is treatable. That number increases to 50% with age. Get a hearing test if you are having any trouble hearing. Protect your bones. Osteoporosis is no joke. If you have it and you suffer a fracture, especially of the hip, you've significantly increased your risk of permanent disability or death. Get serious and ask your doctor to refer you to a bone density test. Women should have a bone density test at age 65. If a woman is at higher risk, a screening test may be needed done at an earlier age. Talk to your doctor. Cholesterol screening. High cholesterol levels are a major reason why people have heart attacks and strokes. The good news, though, is that high cholesterol levels can be treated by diet and medications. That is why measuring your levels of total cholesterol, HDL, good cholesterol, and LDL, bad cholesterol, is important to do regularly. Consider an advanced lipid test, which gives even more information on cardiovascular risk. Medicare will often cover these blood tests. Vaccinations. People older than age 65 should get a pneumococcal vaccination to protect against pneumonia. The CDC recommends the shingles vaccine for those over the age of 60 as well. Also, almost all adults should get an annual flu shot. A one-time diphtheria tetanus booster that also has pertussis vaccine, whooping cough, in it is recommended, followed by diphtheria tetanus booster every 10 years. An important note: become informed of the possible side effects of immunizations before deciding to vaccinate. Aneurysm. The USPSTF recommends one-time screening for abdominal aortic aneurysm, or AAA, by ultrasound in men ages 65 to 75 who have ever smoked. Blood sugar. Diabetes is a potentially life-threatening condition, but it doesn't have to be. The American Diabetes Association recommends that a fasting blood sugar test be done once every 3 years so you can catch diabetes early and manage it. You may need the test done more frequently if you have other conditions or have other risk factors for diabetes. Thyroid hormone test. Thyroid problems are easily missed. That's why some organizations like the American Thyroid Association recommend screening at least once every 5 years, especially for women. The U.S. Preventative Services Task Force, however, says that there is not sufficient proof that screening is of benefit in someone without any symptoms of thyroid disease. Your thyroid, that innocuous-looking gland in your neck, is the body's powerhouse, producing hormones needed for metabolism. Problems with the thyroid can cause hair loss, weight gain or weight loss, fatigue, and depression. Looking for moles. Remember this: although the majority of your sun exposure occurred before age 18, skin cancers can take 20 years or more to develop. Luckily, most skin cancers are curable. The American Cancer Society recommends regular screening. Ask your doctor to check your skin if you have any unusual moles or skin changes. Dental exam. Gum disease can be an important indicator of your overall health. Your teeth, gums, mouth, and throat need to regularly be examined by a dentist. Regular brushing with fluoride toothpaste is important if you want to keep your pearly whites gleaming. Consider using an electric toothbrush. It helps with cleaning and prevention of gum disease. Gum disease increases risk of heart attack. That's another reason to see your dentist regularly. Medical screening tests are gifts that keep on giving. You'll enjoy better health, and you may add years to your life. So make a note to schedule a visit to your dentist and call your doctor each year around your birthday. These visits only take an hour or two of your time, and the results can be priceless. Checkups after the age of 70. Screening guidelines often change after age 75. If you're in that age group, how do you decide which test you need? If you're close to age 75, you may have followed some of the same schedules for mammograms, pap smears, and other screening tests for decades. And if you're like many women, you may be surprised that your physician is suggesting fewer tests or longer intervals between them. The practice seems to fly in the face of conventional wisdom. After all, the risk for many degenerative diseases increases with age. So shouldn't older women be monitored even more closely? The answer is, it depends on the woman. By age 75, there's a growing disparity in biological age among women of the same chronological age. I have patients who are quite frail and others who are in better shape than many 50-year-olds, says Dr. Monara Wrong, Clinical Director of the Geriatric Medicine Unit at Massachusetts General Hospital. Statistics back her up. At age 75, 25% of women live an average of 6.8 more years. 50% live an average of 11.9 more years, and 25% live an average of 17 more years. In general, the more chronic conditions a woman has, the shorter her life expectancy. A woman who has fewer years left and is focused on her overall function may not benefit from detecting a slow-growing cancer that's unlikely to affect the length or quality of her life, while another woman who has a longer life expectancy probably would. How screening guidelines are developed. Screening tests are examinations aimed at detecting disease before symptoms develop. They range from simple, non-invasive tests like blood pressure measurements to procedures such as colonoscopy, which requires preparation and sedation. By detecting diseases before it becomes apparent, clinicians are usually able to treat it more effectively and often cure it. Medical organizations want to be sure that screening tests are used appropriately in people for whom they've proven most effective. Accordingly, they may conduct studies of death rates from a disease in which they've compared to people who've screened for the disease with people in the same category, for example, the same gender, age group, or risk level, who have not been screened. These studies help health officials to assess whether and for which groups of people the potential benefit of a test outweigh the risk. The studies can also be used to calculate statistically the number of people who would need to be tested in order to save a life. The United States Preventative Services Task Force, an independent panel of primary care clinicians established by the U.S. Congress, is responsible for developing federal guidelines for all screening tests. See USPSTF screening guidelines for women ages 50 and over. Many medical specialty societies also formulate their own guidelines. For example, the American Congress of Obstetricians and Gynecologists publishes guidelines for pap smears, and both the National Cancer Institute and American Cancer Society make recommendations for cancer screenings. Guidelines from these organizations don't always match those of the USPSTF, but you and your clinician should be able to reconcile the differences. USPSTF screening guidelines for women: breast cancer, mammogram every 2 years to age 74. Cervical cancer, pap smear every 1 to 3 years to age 65. Colorectal cancer, screening by fecal occult blood testing, sigmoidoscopy, or colonoscopy to age 75. Hearing loss, no recommendation. High blood pressure measurement at unspecified intervals. High cholesterol, lipid test unspecified intervals in women with one or more heart disease risk factors. Osteoporosis, bone density testing with dual energy X-ray absorptiometry at unspecified intervals in women ages 65 and over. Vision loss, no recommendation. What guidelines don't say. The USPSTF has found that there isn't enough evidence to recommend screening women over age 75 for certain diseases, particularly breast cancer, cervical cancer, and colorectal cancer. That doesn't necessarily mean that screening tests aren't effective. In many cases, there just weren't enough older people in the studies to permit a judgment for or against screening. In other cases, screening was recommended, but the panel couldn't determine how often it should be done. It's important to understand that most screening guidelines are developed for the maximum benefit of a whole population rather than the individual. They aren't designed to consider each woman's unique family, history, state of health, and risk factors, not to mention her expectations for her future, treatment preferences, and tolerance for uncertainty. You and your clinician can work together to develop a screening schedule that is appropriate for you. The result should be a marriage of the expert recommendations and your wishes, Dr. Wong says. When you review your screening tests, you might think about what you want them to accomplish. Ideally, they should offer more benefits than risks, and they should accordingly identify a disease or condition for which you are at risk and for which you are willing to be treated. Tests likely to benefit most women. The USPSTF and other medical organizations recommend some screening tests with no age limits. These tests listed below offer substantial potential benefits, pose little or no risk, and are covered by Medicare. Blood pressure measurement. This risk-free test identifies hypertension, a highly treatable condition that affects 58% of women over age 65 and is the major risk factor for both heart disease and stroke, respectively. The first and third leading causes of death in women over age 75. The USPSTF didn't find enough evidence to recommend an optimal screening interval, but the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure recommends blood pressure measurement at least once every 2 years for all adults with blood pressure less than 120/180, and every year for those with prehypertension, that is blood pressure between 120/80 and 139/89. Serum lipid profile. This blood test measures total cholesterol, HDL, good cholesterol, and LDL, bad cholesterol. It's important for calculating your risk of heart attack or stroke and essential for anyone at risk for coronary disease, the top killer of women over age 65. The USPSTF guidelines don't specify how often a lipid profile should be done, but suggest that once every 5 years is reasonable for people at low risk. However, most people in their 70s and 80s are at higher risk simply because of age alone and therefore should be tested more often. Bone density measurement. Your risk for osteoporosis, loss of bone density, great enough to increase fracture risk, mounts steadily after menopause. About 20% of women have osteoporosis at age 70, 40% at age 80, and 67% at age 90. And 1 in 3 women will have an osteoporotic fracture at some time. The gold standard bone density test, dual energy X-ray absorptiometry, is non-invasive, uses minimal radiation, and takes about 20 minutes. The results are evaluated along with other risk factors, and the FRAX tool developed by the World Health Organization, or Fracture Risk Assessment Tool, may be used to predict your risk of fracture in the next 10 years. If your FRAX score indicates a high risk, you and your clinician can discuss your options for bone building. Tests to discuss with your clinician. The tests below aren't recommended by the USPSTF for women over age 75. The NCI and ACS, on the other hand, don't set age limits. If your clinician recommends any of these tests, Medicare will cover the cost. Mammography. It may seem paradoxical, but when your cumulative radiation exposure mounts with each mammogram, your risk of radiation-induced breast cancer actually declines with age. So does your risk of unnecessary biopsy because of false positive mammogram. That means mammography itself poses few risks for women over age 75. So the main issue is how much treatment you would be willing to undergo should breast cancer be discovered. About 20% of breast cancers occur in women age 75 and over, but 90% of those cancers are confined to the breast and nearby lymph nodes, and they're thought to be less aggressive than tumors in younger women. Colonoscopy. This test allows a clinician to look at the lining of the entire colon and remove polyps, growths that sometimes can be cancerous. It's the only screening test that can actually prevent cancer. No one enjoys a colonoscopy or the required prep, so it may come as a relief to learn that the USPSTF doesn't recommend any colon cancer screening after age 75. But other organizations, including the ACS and the American College of Radiology advise screening for everyone over age 50. The rate of colon cancer increases with age each year. 2.5% of 75-year-olds and 3.5% of 85-year-olds are diagnosed with the disease. If you've had precancerous polyps removed or have family history of colon cancer, the risk is higher. The rate of serious complications from colonoscopy, such as colon perforation or major bleeding, is relatively low, but also increases with age. Pap smear. This test identifies cancer cells and abnormal cervical cells that may progress to cancer. The USPSTF recommends against screening women over age 65 who have had normal pap smears and adequate recent screenings and aren't otherwise at high risk for cervical cancer. The ACS and ACOG are a little more specific. They suggest that screenings end at age 65 or 70 in low-risk women who've had 3 consecutive normal pap tests or no abnormal smears for 10 years. Both guidelines acknowledge the declining rate of precancerous lesions in older women and increased risks of false positive tests that could result in unnecessary biopsies of the cervix. ACOG recommends that women resume pap screening if their risk factors increase, the main one being a new sexual partner. Other tests you may need. The USPSTF guidelines don't mention hearing or vision screening in adults because there's too little evidence of their risks and benefits. However, Dr. Wong would like the panel to make recommendations because these 2 senses are so important in preserving function. Here's how things stand now. Eye exams. The American Academy of Ophthalmology recommends eye examinations every year or 2. Including tests for age-related macular degeneration, cataracts, diabetic retinopathy, and glaucoma. Medicare may pay for these tests. It doesn't cover routine exams for visual acuity, although your Medicare supplementary plan may. Hearing tests. About 80% of us have some hearing loss by the age of 80. But there's no standardized test to detect it. As a result, only 10 to 20% of older adults who could benefit from hearing aids actually wear them. There are several ways to evaluate hearing acuity, from a simple whisper test to the use of sophisticated audiology equipment. If you're having difficulty hearing and would be willing to try using a hearing aid, your clinician should be able to suggest the appropriate tests. Medicare will probably pay for the exam, but not the hearing aids. Some Medicare supplement plans include an allowance for hearing aids. Your clinician's informal screening tests. Conversation with your clinician during a routine office visit includes likely a few informal screening tests. You may be asked about your alcohol consumption, your mood, and your memory. Your candid answers can help your clinician assess your risk for substance dependence, depression, and cognitive impairment. A question about recent falls may lead to a discussion about ways to improve your balance. This kind of screening can be critical in preserving your ability to function and your independence. Decisions about screening illustrate one of the upsides of later life medical care. While you may be leaving years of standardized screening tests behind you, you're receiving care tailored specifically for you. Watch your medications. Beware. Better sex, more energy, less body fat? This can all be yours, some docs promise, through the new field of anti-aging medicine. And if those claims sound too good to be true, well, that's because they are. In fact, steering clear could save your life. Hannah Hobbs wasn't afraid of dying. What concerned her was growing old and not being able to run marathons, ride horses, or fly planes. So the 56-year-old Haywood, California woman turned to Alan Mintz, MD, radiologist who founded Syngenix Medical Institute in Las Vegas, which specialized in age management medicine. she was prescribed recombinant human growth hormone, HGH, a synthetic version of the pituitary hormone hawked as a miraculous fountain of youth. Though the U.S. Food and Drug Administration warns that taking HGH poses serious health risks, Hopps, unaware there was any harm, began injecting it into her thigh 6 times a week. She never did grow old. 6 months later, in 2004, she was dead, her liver full of malignant tumors. While it's impossible to prove that HGH therapy contributed to Hopps' death, the use of HGH has been linked to an increased risk of cancer. Dr. Mintz said at the time of Hopps' death that Hopps would not have been treated if he knew she had cancer. Anti-aging is a big market today. Be careful not to be drawn in by anyone selling the latest fix. Taking a pro-aging stance with less is more, and establishing the habits set out in this program is a positive approach to aging. Easy and quick solutions with a big price tag should be considered carefully before partaking. Drug interaction. Shop for a reliable pharmacist. Find someone who cares and that you can trust. Double check all the prescriptions with your trusted pharmacist to be sure there is no conflicting use. While you're at it, check the side effects with them too. There are more opportunities today than ever to learn about your health and to take better care of yourself. It is also important than ever to know about the medicines you take. If you take several different medications, see more than one doctor, or have certain health conditions, you and your doctors need to be aware of all the medicines you take. Doing so will help to avoid potential problems such as drug interactions. Drug interactions may make your drug less effective, cause unexpected side effects, or increase the action of a particular drug. Some drug interactions can even be harmful to you. Reading the label every time you use a non-prescription or prescription drug and taking the time to learn about the drug interactions and side effects with a little bit of knowledge and common sense. Drug interactions fall into 3 broad categories. Drug-drug interactions occur when 2 or more drugs react with each other. This drug-drug interaction may cause you to experience an unexpected side effect. For example, mixing a drug you take to help you sleep, a sedative, and a drug that you take for allergies, an antihistamine, can slow your reactions and make driving a car or operating machinery dangerous. Drug, food, beverage interactions result from drugs reacting with foods or beverages. For example, mixing alcohol with some drugs may cause you to feel tired or slow your reactions. Drug condition interactions may occur when an existing medical condition makes certain drugs potentially harmful. For example, if you have high blood pressure, you could experience an unwanted reaction if you take a nasal decongestant. Drug interactions and over-the-counter medicines. Over-the-counter, OTC, drug labels contain information about ingredients, uses, warnings, and directions that is important to read and understand. The label also includes important information about possible drug interactions. Further, drug labels may change as new information become known. That's why it's especially important to read the label every time you use a drug. The active ingredients and purpose sections list the name and amount of each active ingredient, the purpose of each active ingredient. The uses section of the label tells you what the drug is used for, helps you find the best drug for your specific symptoms. The warning section of the label provides important drug interaction and precaution information such as when to talk to a doctor or pharmacist before use, the medical conditions that may make the drug less effective or not safe, under what circumstances the drug should not be used, when to stop taking the drug. The directions section of the label tells you the length of time, the amount of product that you may safely use, any special instructions on how to use the product. The other information section of the label tells you Required information about certain ingredients such as sodium content for people with dietary restrictions or allergies. The inactive ingredients section of the label tells you the name of each inactive ingredient, such as colorings, bindings, etc. The questions or comments section of the label, if included, provides telephone numbers of a source to answer questions about the product. Learning more about drug interactions. Talk to your doctor or pharmacist about drugs you take. When your doctor prescribes a new drug, discuss all OTC and prescription drugs, dietary supplements, vitamins, botanicals, minerals, and herbals you take, as well as the foods you eat. Ask your pharmacist for the package insert for each prescription drug you take. The package insert provides more information about potential drug interactions. Before taking a drug, ask your doctor or pharmacist the following questions. Can I take it with other drugs? Should I avoid certain foods, beverages, or other products? What are possible drug interaction signs I should know about? How will the drug work in my body? Is there more information available about the drug or my condition on the internet or in the health and medical literature? Know how to take drugs safely and responsibly. Remember, the drug label will tell you what the drug is used for, how to take the drug, how to reduce the risk of the drug interacting, and unwanted side effects. If you still have questions after reading the drug product label, ask your doctor or pharmacist for more information. Remember that different OTC drugs may contain the same active ingredient. If you're taking more than one OTC drug, pay attention to the active ingredients used in the products to avoid taking too much of a particular ingredient. Under certain circumstances, such as if you are pregnant or breastfeeding, you should talk to your doctor before you take any medicine. Also, make sure you know what ingredients are contained in the medicines you take. Doing so will help you to avoid possible allergic reactions. Skincare. Reduce skin exposure. Keep skin moist. Healthy skin. 1. Protect your skin from the sun. Sun protection forms the foundation of every aging skincare plan. The sun's rays make our skin age more quickly. We have so much evidence that the sun prematurely ages our skin that there is actually a word to describe this effect. This word is photoaging. To help patients protect their skin from the sun and other harmful UV rays, dermatologists offer these tips. Seek shade. Be sure to seek shade between 10 a.m. and 2 p.m. and whenever your shadow looks shorter than you are. Cover up in style. Whenever possible, wear a wide brim hat, pants, and long sleeves. Gloves to help minimize common signs of aging on our hands, such as age spots. Sunglasses to help reduce fine lines around our eyes. Slather on the sunscreen every day before going outdoors. To protect your skin, apply sunscreen to all skin that clothing will not cover. You will want to use a sunscreen that offers broad spectrum protection, SPF 30 or higher, and water resistance. Number 2, forget about indoor tanning. The sun, tanning beds, and sun lamps expose you to harmful UV rays. These rays accelerate skin aging. Number 3, apply moisturizer every day. As we age, skin becomes drier, fine lines and wrinkles appear. Moisture traps water in our skin, giving it a more youthful appearance. For best results, use a facial moisturizer, body moisturizer, and lip balm. Number 4, wash away dirt and grime twice a day. How you wash your face can affect your appearance. For best results, you want to wash with warm water and a mild cleanser rather than soap. You also should avoid scrubbing your skin clean. Number 5, stop smoking. Tobacco smoke contains toxins that can lead to a smoker's face. Signs of smoker's face include dull and dry complexion, loss of skin's firmness, premature lines and wrinkles, and leathery skin. Number 6, eat healthy foods. A healthy diet promotes healthy skin. Make sure you eat plenty of fruits and vegetables, lean proteins, and healthy fats. 7, get enough sleep. It's called beauty rest for a reason. Sleep gives your body time to refresh and renew itself. 8, if you want to include anti-aging skin products in your plan, dermatologists recommend that you select these products carefully. Nurture happiness. Stay connected. In case you haven't taken advantage of our community, I encourage you to do so. Our community is an incredible bonus and useful tool to make changes and feel a part of things. The people in the community are people who are in the same boat as you. They are facing the same struggles and looking for the same outcome. Once they come together, they share knowledge, information, dreams, realities, successes, and failures. In order to be a productive member of a group or tribe like this, you must enter selflessly. You must realize that there is enough abundance to go around. The power is in the group. When we get over jealousy and competition and share our resources, we go so far beyond self-promotion into a place that is more universal. That is where the sweet spot is. The question to ask is, who am I surrounding myself with? People who encourage growth and complement your efforts, or people who are suppressing possibility? You don't always get to pick who our coworkers, family, or neighbors are, but you do choose those in your tribe. Are you choosing to be with the people who say, I can't? Or someone who says, I will find out how? Are you with people who make you crazy? Or people who encourage growth? Make a list of the people you'd like to surround yourself with. If you don't know, take a week, look for them, and come back to make your list. When you're with people, you know the big secret. That is that we are here for others. Invisible hands, tribe, team, collaboration, group, friends. Benefits of invisible hands. Accountability and support. Contribution and shared resources. Breaking monotony and isolation of doing it alone. New perspectives. Through history, people have found strength in communities formed in worship and religion, sports, education, addiction and recovery, and political affiliation. These are people who share the same beliefs and intentions and add strength, purpose, and conviction to their lives. One of the most important human needs is to belong. Belonging also fills other human needs of importance, contribution, socialization, and security. Community involvement has actually been shown to be a physical benefit. Dr. Rudin's studies show that without sufficient community connection, our brains produce less serotonin, a key neurotransmitter that gives us a feeling of security and well-being. When serotonin levels are deficient, another one of our natural chemicals, dopamine, becomes overactive. Become a part of a community, tribe, or group who support each other in growth. There are groups spreading out all over the place. They may be in your geographical community or on the internet. Whether it's health, spiritual, religious, weight loss, authors, or blogging. If there's something that you want to do better, find a group of like-minded people and thrive. Goal setting. Steps, goals, journal. The more control you have over a goal, the better chance you have of attaining it. If you set the goal by the performance of the action rather than the outcome, you will be happier. For example, you might set a goal to finish a 5K, which is performance-based, rather than to score in the top 10 of the 5K, which is outcome-based. There are several steps in goal setting. 1. Become aware of a need. 2. Envision the outcome. 3. Set the intention. 4. Focus on the goal. 5. Take action to achieve the goal. 6. Have faith that if you set the intention, focus, and take action, you will reach your goal or the best outcome. Now take a moment to fill out your daily goal sheets. Section 3. The Truth. Darcy Huggins, Health Coach. Aging is a mindset and is not the same as maturity. We've enjoyed spending this time with you. Thank you.